Hello to everyone joining this week's Al-Ghaf Dynamics Health Connect Middle East podcast episode. Today, we will be discussing numerous important key developments these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to June 25, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform Health Connect Middle East. This week saw Middle Eastern nations advancing health sector reforms, research collaborations, and wellness campaigns amid persistent public health challenges. Across the region, governments expanded healthcare access and quality as a matter of national priority. Major policy moves, from Jordan's groundbreaking universal cancer care plan to Iraq's new antimicrobial resistance strategy, underscored a shift toward viewing health as a guaranteed right. Life sciences innovation and biotech partnerships gain momentum, with Saudi Arabia forging global R&D alliances and the UAE earning international accreditation for research ethics. Meanwhile, public health crises continued to test resilience. Gaza's medical system neared collapse under conflict conditions, Syria's hospitals struggled with damage and shortages, and malnutrition remained an acute threat in Yemen. At the same time, wellness initiatives flourished, from mass yoga events uniting communities to anti-drug campaigns and tobacco control successes, reflecting a growing emphasis on preventive health and well-being. Digital health and hospital infrastructure also advanced, leveraging technology and investment to modernize care delivery. In sum, the week was marked by dynamic contrasts, bold improvements in healthcare policy and innovation on one hand, and humanitarian health needs on the other. Today's podcast details these developments across all Middle Eastern countries. So let's begin. Let's first discuss healthcare policy and government initiatives. Jordan, in a landmark policy shift, Jordan announced free cancer treatment for over 4.1 million citizens at the King Hussein Cancer Center, signaling a move toward more equitable, rights-based healthcare. Backed by $124 million in funding, effective early 2026, the program prioritizes children, seniors, and low-income patients. Health experts hailed it as a transition from ad hoc exemptions to a structured system guaranteeing care as a right, with calls to enshrine the commitment in law. The plan, part of Jordan's economic modernization vision, is spurring broader health reforms, including a push to establish a national cancer fund, scale up stem cell therapies, and expand early screening programs. Jordan's model of public-private coordination in oncology is now viewed as a regional exemplar of health system strengthening and social protection. Iraq, the government took a major step to combat antimicrobial resistance, AMR, by finalizing an updated National Action Plan 2026 to 2030 after a multi-stakeholder workshop in Baghdad. Developed with WHO support, the plan adopts a One Health approach integrating human, animal, and environmental health sectors. It sets out practical, measurable strategies to strengthen Iraq's health system against AMR, with an emphasis on cross-sectoral collaboration, policy alignment, and high-level political commitment. Health officials stressed that successful implementation will require sustained funding and coordination, but hailed the plan as a pivotal step to protect future generations from drug-resistant infections. Egypt, the government highlighted its leadership in regional health initiatives at the Africa Health Excon 2025 in Cairo. Health Minister Khalid Abdel-Ghaffar urged African nations to shape their own health future through domestic investment and self-reliance. At a steering committee meeting, he outlined 3 strategic priorities agreed for the continent. 1. Boosting domestic health financing to achieve universal coverage. 2. Expanding local manufacturing of medicines and supplies to improve access and resilience. And 3. Accelerating digital transformation of health systems. Egypt affirmed its commitment to these goals, noting its progress in e-health and readiness to support interoperable digital networks, and called for stronger regional coordination to turn plans into action. The week also saw Egypt's cabinet allocate an additional EGP 3 billion to the state-funded medical treatment program, March-June 2025, to clear surgical backlogs and waiting lists, reflecting continued post-pandemic efforts to strengthen public healthcare delivery. Saudi Arabia, authorities earned international recognition for health policy leadership. The World Health Organization designated the Saudi Food and Drug Authority, SFDA, as a regional center for nutrition, acknowledging Saudi Arabia's success in advancing healthy food policies. The SFDA will now guide 22 Eastern Mediterranean countries on strategies like reducing salt, sugar, eliminating trans fats, and curbing junk food marketing to children. This honor aligns with Saudi Vision 2030's health sector transformation program and caps Saudi's model reforms, e.g. banning industrial trans fats, that WHO praised as best practices. Separately, Saudi officials hosted Gulf counterparts to coordinate expansion of the Healthy Cities initiative. At a GCC meeting in Kuwait, they emphasized unified action to integrate health into urban planning for sustainable development. Saudi Arabia's own Healthy Cities network has grown, and its success in removing harmful ingredients and promoting wellness is being shared regionally as part of its Vision 2030 drive for disease prevention and improved quality of life. GCC labor welfare. Across the Gulf, governments reinforced long-standing worker health protections amid extreme summer heat. In the UAE, the midday work ban kicked in for the 21st year, prohibiting outdoor labor from 12:30 to 3 p.m. June 15 to September 15 to prevent heat stress injuries. Compliance has exceeded 99% in recent years, and officials credit the policy, coupled with private sector support like shaded rest areas, with virtually eliminating summer heat illnesses. Similarly, Oman's Ministry of Health issued updated heat safety guidelines for workers, mandating hydration breaks, protective gear, and employer emergency plans. These measures form part of Gulf states' broader occupational health regulations to safeguard workers' wellness during the hottest months. Next we have life sciences and research innovation. United Arab Emirates, Abu Dhabi celebrated a milestone in research ethics and clinical science. Cleveland Clinic Abu Dhabi became the first hospital in the UAE to earn full accreditation from the Association for the Accreditation of Human Research Protection Programs, AAHRPP. The globally recognized Gold Seal certifies that the hospital's research protocols meet the highest international standards for ethics and participant safety. Since launching its research program a decade ago, Cleveland Clinic Abu Dhabi has conducted over 600 studies, 40 completed last year, and was named the nation's top research hospital. Leaders said the accreditation sets a new benchmark for integrity and innovation in the region, positioning the UAE as a rising hub for world-class medical research. This achievement dovetails with the UAE's strategy of investing in advanced healthcare and reinforces its commitment to ethical research that accelerates therapeutic breakthroughs. Saudi Arabia, the kingdom made a dramatic entrance onto the global biotech stage at the BIO International Convention in Boston. Saudi Arabia debuted its first national pavilion at BIO 2025, unveiling a slate of over a dozen partnership moves with leading biotech and pharma companies. The health holding company signed high-impact agreements with firms like Vertex Pharmaceuticals, Amgen, and Illumina, aiming to localize precision medicine, genetic diagnostics, and cutting-edge therapeutics in Saudi Arabia. Leading research centers followed suit. King Faisal Specialist Hospital partnered with Germfree on advanced lab manufacturing, and KAIMRC inked a genomics collaboration with Illumina. Homegrown Saudi startups also attracted international allies. For example, Novo Genomics will work with Tracer Biotechnologies on ctDNA cancer monitoring, and Kairama Bio teamed with Digibiomics on exposomics diagnostics. These initiatives flow from Saudi's new national biotechnology strategy, championed by the Crown Prince, which envisions the kingdom as a global destination for life science innovation. Officials emphasized that by leveraging AI, fast-track clinical trial approvals, and robust investment, Saudi Arabia is here not just to observe but to lead in biotech. The pavilion's resounding message that Saudi is building an innovation-ready ecosystem and is open for partnerships across the value chain was reinforced by the presence of 25 Saudi institutions and 160-plus delegates at BIO, one of the largest country delegations at the event. Observers noted that the flurry of deals marks a turning point, anchoring Saudi's Vision 2030 ambitions in tangible R&D collaborations that will bring new therapies, clinical trials, and manufacturing capacity to the region. Qatar, the country continued to cultivate its emerging research and innovation sector. In Doha, Weill Cornell Medicine Qatar, WCMQ, announced new biomedical research grants focused on genomics and precision medicine, building on Qatar Foundation's genomics strategy, while Sidra Medicine reported progress in its clinical trials unit for pediatric diseases, an area of growing regional importance. These efforts, along with Qatar's hosting of global health forums through the World Innovation Summit for Health, WISH, signal its intent to be a regional knowledge hub. At Expo 2025 Osaka, Qatar's WISH showcased cutting-edge research on conflict healthcare, detailed in Section 4, as part of its mission to connect policy with evidence-based innovation. Additionally, Qatar University's Biomedical Research Center highlighted a recent publication on novel diabetes biomarkers, exemplifying how local scientists contribute to worldwide health research advancements. Regional collaboration, Middle Eastern scientists and health institutions are increasingly pooling expertise. Jordan and Algeria this week announced plans to strengthen cooperation in pharmaceuticals and medical research, following a high-level visit by Jordan's health minister to Algiers. The two countries will exchange knowledge on drug manufacturing and vaccine production as part of a broader Arab collaboration drive. Similarly, Egypt and South Africa's health ministers met on the sidelines of Africa Health Excon in Cairo to explore joint R&D on vaccines and pandemic preparedness. These discussions reflect a growing recognition that regional health challenges, from communicable diseases to drug security, are best met through shared innovation and scientific partnership. Biotech and pharmaceutical developments are next. Egypt, highlighting its pharmaceutical self-reliance, Egypt's health minister announced that 91% of medicines consumed nationwide are now produced locally, the highest rate in Africa. This achievement, unveiled during Africa Health Excon on June 25, reinforces Egypt's position as a continental leader in pharmaceutical manufacturing. Minister Khaled Abdel Ghaffar noted Egypt is the first and only African country meeting over 90% of domestic drug needs, underscoring its robust generics industry and capacity to supply neighboring markets. Officials credit policies encouraging local production to reduce import dependence and improve medicine security. The ministry also reported that Egypt's pharmaceutical exports reached $1.1 billion last year, reflecting growing competitiveness regionally and globally. With strong government backing, Egyptian pharma firms are now expanding vaccine manufacturing and biotech research, including a partnership with South Africa to develop vaccines for African markets. These strides come alongside Egypt's ongoing initiatives to localize production of high-cost drugs and position itself as a hub for African pharma innovation. Saudi Arabia, as part of its aggressive biotech strategy, Saudi Arabia showcased an ambitious public-private investment plan at the BIO 2025 convention. In addition to the moves with major global firms, Vertex, Amgen, Illumina, etc., the kingdom announced the launch of an advanced therapeutics campus in Riyadh, a fully integrated biotech center that will support manufacturing of cell and gene therapies. This campus, developed in partnership with international CDMOs, contract development and manufacturing organizations, aims to make Saudi Arabia a regional supply base for cutting-edge biologics and personalized medicines. Meanwhile, the Saudi Ministry of Investment reported that venture capital funding in health and life science startups has doubled year-on-year, catalyzed by government incubators and the vast digital health market, projected to reach $13 billion by 2031. With regulatory reforms streamlining clinical trials and fast-tracking approvals via the SFDA, Saudi biotech companies are attracting foreign partnerships more than ever. The momentum from Boston's BIO Summit is expected to carry into Riyadh's own global health exhibition later this year, as the kingdom seeks to convert moves into on-the-ground facilities and products. Iran, despite geopolitical tensions, Iran's pharmaceutical sector made quiet advances. The health ministry announced the successful development of a new locally produced insulin analog for diabetes management, aiming to reduce reliance on imported insulin amid sanction-related shortages. Iran's biotech firms also reported progress in formulating biosimilar cancer therapies and vaccines, notably, the Pasteur Institute of Iran and Cuban partners expanded trials of a conjugate pneumococcal vaccine that could hit regional markets in the coming year. Additionally, in a sign of resilience, Iran's generic drug output continued to meet 97% of domestic prescription demand, according to officials at the Iran Pharma Expo, a statistic frequently highlighted in Tehran's outreach to global South health partners. The Gulf states saw notable private sector activity in healthcare investments. In Bahrain, for example, Al-Hilal Healthcare Group acquired Middle East Hospital in Segaya and launched it as Al-Hilal Premier Hospital, its second hospital in the kingdom, expanding the country's private inpatient capacity. Kuwait's pharma market also drew attention from international investors this week, as a leading Gulf pharmaceutical distributor announced a joint venture with a European nutraceutical company to produce supplements locally, a bid to capitalize on growing demand for wellness products. Meanwhile, Qatar's Ibn Sina Medical partnered with Novo Nordisk to introduce the anti-obesity drug Wegovy to the Qatari market, reflecting the region-wide focus on diabetes and obesity management. These developments indicate that Middle East health markets remain vibrant, with governments and businesses alike prioritizing pharmaceutical innovation, localization, and timely access to new therapies. Always a key area to discuss next: public health challenges and disease outbreaks. Palestine, Gaza. The Gaza Strip's health system verged on collapse amid ongoing conflict and blockade. The near-total destruction of medical infrastructure and depletion of supplies have placed thousands of patients at extreme risk. On June 25, the UAE, in coordination with WHO, delivered an emergency batch of aid under Operation Chivalrous Night 3 to help alleviate Gaza's worsening health crisis. This shipment included essential medicines, pediatric consumables, 150 fully equipped hospital beds, and field tents to set up temporary clinics. With many hospitals heavily damaged or out of service, the Emirati Field Hospital in southern Gaza has become a lifeline. UAE officials stressed that supporting Gaza's health sector is a top humanitarian priority, reaffirming their steadfast commitment to the Palestinian people. Despite such relief efforts, needs remain dire. WHO warned this week that fuel shortages threaten basic hospital functions, and UNRWA officials cautioned that Gaza's last remaining health facilities could shut down completely without immediate supplies. Communicable disease risks are rising in the densely populated enclave as water, sanitation, and vaccination systems are in disarray. Syria, over 12 years into its conflict, Syria's public health challenges are acute and compounding. The UN reported that nearly 16 million Syrians now require urgent health and humanitarian support, as the health system remains under severe strain. According to a UN briefing, only 59% of hospitals and 46% of primary health centers are fully functional nationwide, due to infrastructure damage, power cuts, and staff shortages. Shortages of essential medicines are critical, and treatment costs have become unaffordable for many amid economic collapse. The WHO highlighted that over 416,000 Syrian children face severe malnutrition in what it called a staggering nutrition crisis. In opposition-held northwest Syria, the health cluster noted continued outbreaks of infectious diseases like cholera, as overcrowded displacement camps struggle with poor water and sanitation. The UN Secretary-General's envoy warned the Security Council on June 17 that without sustained aid access, including cross-border deliveries, which have increased significantly this year, Syria risks mortal danger from a convergence of violence, disease, and hunger. Health officials are also concerned about explosive remnants of war, more than 1,000 casualties since late 2024, which not only cause injuries but hinder repair of health facilities and delivery of aid. Efforts are underway to vaccinate children against polio and measles in high-risk areas, and relief agencies are appealing for $2 billion to fund the health humanitarian response through year's end, warning that current funding covers barely 12% of needed assistance. Yemen, humanitarian health needs remain among the most severe in the world. A joint WHO-UAE program launched on June 1 aims to combat malnutrition in Yemen's Socotra Island, where food insecurity and repeated outbreaks of cholera, dengue, and measles have created a public health emergency. On Socotra, population ~83,000, 92.7% of pregnant women are anemic and 37% of children have never received a vaccine dose, alarming indicators of a failing health system. The new initiative will strengthen 32 local health facilities, which currently lack even a central laboratory or medicine warehouse, and deploy an integrated approach over 2 years to reduce malnutrition-related mortality by 20%. It focuses on boosting maternal and child healthcare coverage to 80% of facilities, improving outbreak preparedness for cyclones and epidemics, and establishing a multi-sector coordination platform for data and planning. Beyond Socotra, Yemen faces rising acute malnutrition. UNICEF reported a 34% surge in acutely malnourished children under 5 in government-held areas, driven by ongoing conflict, disease outbreaks, and economic collapse. Cholera has resurfaced in multiple governorates as well. Medicines Sans Frontiers opened a 20-bed cholera treatment center after a surge of acute watery diarrhea cases in June. Health infrastructure remains extremely fragile, and only a massive scale-up of aid and stabilization efforts can stave off what UN officials call an impending catastrophe in Yemen's health sector. Iran, the regional spillover of conflict reached Iran's borders this month, impacting public health security. On June 24, Iran's Ministry of Health announced that 606 people have been killed and 5,332 injured in Iran since the start of military acts on Iranian territory. These casualty figures, released via Iranian and Qatari news agencies, underscore the heavy toll of the 12-day conflict on civilians and infrastructure. Iranian hospitals in border areas struggle to treat mass trauma injuries amid airstrike damage and power outages. While a ceasefire took hold by midweek, as reported in regional media, the health repercussions persist. Emergency teams continue clearing rubble and tending to burn and blast injuries, and there are concerns about unexploded ordnance posing long-term risks, as seen in Syria and Lebanon. Iran's public health officials have also been on alert for any radiological or chemical exposure incidents stemming from the conflict, though none have been confirmed. The situation has somewhat stabilized post-ceasefire, but Iran's health system, already strained by sanctions and COVID-19 after effects, now faces the additional burden of wartime recovery, from mental health support for survivors to reconstruction of damaged clinics. Lebanon, though not an active war theater this week, Lebanon's health system remained in a critical state exacerbated by the regional turmoil. The economic crisis continued to cripple medical services. Reports indicated many hospitals struggle to keep generators running due to fuel shortages, leading to daily power outages of several hours. There are scant supplies of medicines, especially for chronic illnesses, as the country's foreign currency crunch impedes imports. Humanitarian organizations like MSF warned that vulnerable populations are foregoing care. For example, vaccine coverage for children has dropped and intermittent measles outbreaks have occurred in low-income areas of Beirut and the Bekaa. Health officials are planning emergency immunization campaigns to contain them. Additionally, with conflict next door, Lebanon's hospitals prepared contingency plans. The Ministry of Health noted that if violence were to escalate in the south, up to 28 hospitals could be at risk of closure or evacuation. On a positive note, mental health awareness initiatives have gained traction. The Order of Nurses launched a community counseling program on June 21, aiming to address the dramatic rise in depression and anxiety cases noted over the past year. International donors in a Paris meeting this week discussed targeted aid to Lebanon's health sector, but large-scale support hinges on broader economic reforms. For now, Lebanese healthcare workers persist under extraordinarily tough conditions, trying to hold the line against system collapse as one of the region's once best health systems is now among its most fragile. Next we have wellness and health promotion. United Arab Emirates, the UAE marked International Yoga Day, June 21, with sweeping enthusiasm. From sunrise to sunset, thousands of residents rolled out mats across all 7 emirates in mass yoga sessions championing holistic wellness. Under the global theme, Yoga for One Earth, One Health, events united diverse nationalities, even pets joined. Puppy yoga classes in Abu Dhabi, highlighting yoga's inclusive appeal. In Dubai alone, iconic landmarks like the Burj Khalifa, Dubai Frame, parks, and malls turned into giant open-air studios as over 30,000 people practiced yoga with instructors. The Indian Embassy, a key organizer, noted the participation of UAE ministers and celebrities. Indian tennis star Sania Mirza led a session in Abu Dhabi, as a sign of high-level support. A special gathering at Louvre Abu Dhabi blended culture with wellness, and a mega session at Expo Center Sharjah drew 5,000 enthusiasts. Health experts in the UAE praised the annual Yoga Day as boosting not only physical fitness but also community mental health, in line with the country's broader Sports for All and happiness initiatives. Kuwait, the Ministry of Health concluded a nationwide anti-drug awareness campaign on June 25, as part of the week marking International Day Against Drug Abuse, June 26. Launched on June 12 in partnership with the Kuwait Center for Addiction Treatment, the campaign targeted youth with the slogan, "The evidence is clear, invest in prevention to break the cycle." It featured school seminars, social media outreach, and a public survey that drew 482 respondents to gauge knowledge on addiction. Results showed encouraging awareness: 55% recognized addiction as a chronic, treatable disease and 60% correctly identified root causes like family issues, peer pressure, and psychological vulnerabilities. Over 71% even understood the serious health consequences, hepatitis, HIV, miscarriages, linked to drug use. Officials expressed optimism that 64% of respondents emphasized prevention via family engagement, school support, and community programs. Kuwaiti authorities underscored that such education campaigns are a vital shield against narcotics, especially for protecting adolescents. The private sector also engaged. A local real estate group sponsored parts of the campaign as a community service, aligning with Kuwait's strategy of multi-stakeholder social responsibility in health promotion. Qatar, in a notable tobacco control achievement, Hamad Medical Corporation's Tobacco Control Center received the WHO's 2025 World No Tobacco Day Award. This is the second time HMC's specialized cessation clinic has earned the honor, first in 2021, reflecting its impactful efforts to help Qatar's population quit smoking. The center, a WHO collaborating center since 2017, was recognized for significant efforts in reducing tobacco use and helping the public in Qatar and the Eastern Mediterranean region to quit all forms of tobacco. Its initiatives include extensive school and workplace education programs, free quit clinics, and training for healthcare providers on nicotine dependence treatment. With over 90% of its patients reporting improved health outcomes, the center has been a regional model whose representative in Doha commended it as well-deserved and highlighted the importance of sustained collaboration to curb tobacco use. Qatar's success comes as smoking rates among adult men have modestly declined, and the country has implemented strict tobacco taxes and indoor smoking bans. The award was presented in Doha on June 22, further energizing Qatar's tobacco-free 2030 goal. In other wellness news, Qatar celebrated World Blood Donor Day, June 14, with a nationwide drive that saw a record number of young Qataris registering as repeat donors, a positive sign of growing civic engagement in health causes. Bahrain, health authorities and civil society teamed up to promote wellness and preventive care. June 19 was World Sickle Cell Awareness Day, and Bahraini advocacy groups used the occasion to educate patients on coping strategies during the hot summer months. The Bahrain Society for Sickle Cell Disease urged SCD patients to stay well hydrated and avoid strenuous sun exposure to prevent painful crises, advice particularly pertinent as temperatures climb to 40 degrees Celsius and above. The Society's chairman noted that contrary to popular belief, dehydration in the summer causes more SCD complications than cold weather, citing past statistics where June-August saw spikes in sickle cell hospitalizations. Public campaigns on social media shared tips like consuming water-rich fruits. Watermelon drives were even organized in some clinics, and emphasized not delaying hospital care when warning signs appear. Meanwhile, Bahrain's Ministry of Health continued its Healthy Cities agenda. Local communities in Manama organized weekend farmers markets and walking groups as part of an initiative to encourage active lifestyles and better nutrition. These grassroots efforts support Bahrain's pledge under the GCC Healthy Cities network to increase green spaces and reduce lifestyle diseases. Though small in scale, such community wellness programs are fostering a culture of health and are backed by Bahraini officials as key to preventing chronic conditions like diabetes and hypertension. Digital health innovation has consistent developments. Let's go into them now. The momentum in digital health continued unabated. Saudi Arabia is emerging as a regional pioneer in AI-driven telemedicine, fundamentally reshaping care delivery for remote and underserved communities. Building on its Vision 2030 investments, Saudi Arabia's Seha Virtual Hospital, a fully digital facility linking specialists across the kingdom, has expanded its services this year to include AI-assisted diagnostics for radiology and an ICU program. Experts noted that this virtual care model, which enables real-time consultations and critical care support across hospitals, is moving the system from reactive sick care to proactive health management. It has already demonstrated value by reducing the need for patient transfers and improving early detection of complications. Saudi officials reported that during the recent Hajj season, AI triage tools and remote monitoring, including an algorithm by Korean firm Unit to screen pilgrims' X-rays for respiratory illness, were deployed at scale. Over 470,000 virtual consultations were provided and dozens of early pneumonia cases flagged among pilgrims. The kingdom's digital health market, valued at $3.2 billion in 2024, is forecast to quadruple by 2031, propelled by such innovations in AI diagnostics, wearables integration, and big data analytics. Neighboring GCC states are following suit. Bahrain and Oman both announced new telehealth platforms this week. Bahrain's Ministry of Health is piloting a 24/7 video consultation service for primary care, while Oman's largest hospital began using an AI chatbot to streamline patient inquiries and appointment bookings. These developments illustrate a region-wide pivot towards digital solutions to boost access and efficiency in healthcare. United Arab Emirates, the UAE continued integrating smart technologies into health services. The Dubai Health Authority, DHA, reported that its flagship, Doctor for Every Citizen, telemedicine program launched during COVID-19 has now handled over 2 million virtual consultations since inception and maintains high patient satisfaction. This week, DHA rolled out an AI-powered symptom checker in Arabic and English on its mobile app, which uses algorithms to triage patients to appropriate care or self-care advice. Meanwhile, Abu Dhabi expanded the use of AI in hospital operations. Two major hospitals in the capital introduced an AI-driven scheduling system that optimizes operating theater slots and reduces patient wait times for elective surgeries by an estimated 20%. Abu Dhabi also hosted a regional digital health summit on June 23 where healthcare leaders from 10 countries discussed data interoperability and cybersecurity in health, a crucial topic as more patient data moves online. A key announcement from the summit was that the UAE will collaborate with international standards bodies to establish a GCC-wide health information exchange standard by 2026, enabling seamless and secure sharing of electronic medical records across borders. This initiative is expected to particularly benefit expatriate patients and facilitate medical tourism in the region. Egypt, progress in digital health is accelerating as Egypt leverages its large tech talent pool. The Egyptian Ministry of Health this week highlighted the expansion of its national health portal, which now offers over 100 e-services including online appointment booking, telepharmacy consultations, and digital vaccination certificates. During Africa Health XCon, officials revealed that Egypt's pilot of electronic health records, EHR, in public hospitals has reached a new milestone. 20 hospitals have gone paperless, and medication errors have dropped by 75% in those facilities thanks to e-prescribing. The Health Ministry also signed an MOU with a German health tech company to introduce AI tools for pathology, aimed at speeding up cancer diagnosis, and to develop a centralized analytics dashboard for population health data. This comes as Egypt prioritizes digital transformation in its universal health insurance rollout. Indeed, Health Minister Al-Ghaf noted that digital infrastructure is one of the 3 strategic priorities, alongside financing and local pharma production, for strengthening Africa's health systems. Outside the Gulf and Egypt, digital health adoption is more nascent but making headway. Jordan announced the nationwide implementation of its Hakim e-health system, which digitizes patient records, is now 95% complete in military hospitals and 75% in public hospitals and aims for full coverage by year-end. Lebanon's e-health efforts, meanwhile, have been slowed by the crisis, but one bright spot is the private sector. A Beirut-based startup launched a teletherapy platform connecting Lebanese diaspora psychologists with patients in Lebanon, offering mental health support via video at subsidized rates, a timely innovation given rising post-trauma stress in the population. Now let's discuss the important area of development with hospitals. Iraq, the country made a significant post-conflict infrastructure advance with the opening of a state-of-the-art rehabilitation complex in Baghdad. On June 20, Prime Minister Mohammed S. Al-Sudani inaugurated the Marta al-Muhandis Rehabilitation Center, a 300-bed facility dedicated to physical therapy, prosthetics, and mental health services for war-wounded and disabled patients. This modern complex, equipped with hydrotherapy pools, advanced prosthetic labs, and vocational training gyms, is the largest of its kind in Iraq. It fills a critical gap in long-term care for the thousands of Iraqis who suffered amputations or spinal injuries during years of conflict and terrorism. At the ribbon cutting, officials noted the center will also serve as a national training hub for physiatrists and trauma psychologists, aiming to improve rehabilitation practices across Iraq's health system. Its launch, supported by international donors, was praised by WHO as a milestone in rebuilding lives in Iraq. Gulf states, hospital expansion and upgrades were prominent in the wealthy GCC countries. Kuwait officially opened the new Sheikh Jabbar Al Ahmad Military Hospital's civilian wing on June 21, adding 200 beds and a specialized cardiac center that will serve both military personnel and the public. The facility boasts cutting-edge surgical theaters and the region's first AI-assisted intensive care unit, which monitors patients with predictive analytics. In Bahrain, the private sector's role grew with Al-Hilal Healthcare Group's launch of Al-Hilal Premier Hospital following its acquisition of Middle East Hospital in Sigaya. The 65-bed multispecialty hospital brings new competition to Bahrain's private healthcare market and will provide services ranging from cardiology to oncology with a team of expert surgeons, many recruited from India and Europe. Health regulators in Bahrain welcomed this expansion, noting that increased private capacity can help meet rising demand and ease pressure on public hospitals like Salmania. Palestine, West Bank. Amid relative calm compared to Gaza, the West Bank saw incremental hospital improvements through international aid. The Palestinian Ministry of Health, with funding from the World Bank, broke ground on a new emergency department at Ramallah Medical Complex on June 19. This ED will double the complex's intake capacity and modernize trauma care with updated triage and imaging areas. The project is part of the $30 million Health System Resilience Project, which also delivered a batch of ICU ventilators and generators to West Bank hospitals this week, critical given the territory's intermittent power supply. Furthermore, in Nablus, an NGO-funded mobile clinic bus was launched to reach remote villages weekly, providing basic checkups and maternal health services to communities with no nearby health centers. Such initiatives, though small-scale, improve healthcare access in Area C regions of the West Bank. Lebanon, hospitals continue to operate under duress. Administrators of major hospitals like the American University of Beirut Medical Center, AUBMC, warned that fuel and funding shortages are severely limiting services. Many hospitals have cut non-urgent surgeries due to supply rationing. However, the week saw some relief. The Lebanese diaspora stepped up with donations. A coalition of Lebanese American organizations delivered 5 shipments of medical supplies and medications valued at $1.5 million, which arrived at Rafik Hariri University Hospital on June 23. This included much-needed cancer drugs, antibiotics, and dialysis consumables. Additionally, the International Committee of the Red Cross, ICRC, is now subsidizing fuel for generators at 3 large public hospitals through August to ensure emergency and dialysis units can run continuously. Hospital directors noted these are stopgap measures and again pleaded for a sustainable solution to Lebanon's healthcare financing crisis. Many have floated a proposal for an international health rescue fund for Lebanon, administered by UN agencies, to at least guarantee dialysis, cancer treatment, and trauma care for the next year. The idea is gaining traction among some donors, but political hurdles remain. And finally, let's talk about population health management in the Middle East. Saudi Arabia, the kingdom's focus on preventive care and healthy populations was evident in its new regional nutrition hub role, as noted in Section 1, and in ongoing public health data initiatives. This week the Saudi Public Health Authority released the first results from its Etizani National Health Survey, which is tracking NCD, non-communicable disease, risk factors in a cohort of 10,000 Saudis. The survey found modest improvements. Adult smoking prevalence fell from 17.5% to 16% in the past 2 years, and average daily physical activity minutes increased slightly, in line with Vision 2030 health goals. However, obesity rates remain high, around 28% of adults, and diabetes prevalence steady at 18%, prompting officials to stress continued efforts in lifestyle modification programs. Saudi Arabia is leveraging its national digital health platform, NAFIS, to integrate electronic health records for better chronic disease management. As of June, over 5 million individuals have a unified digital record that primary care doctors can access, enabling more coordinated treatment for conditions like hypertension and diabetes. Additionally, Saudi Arabia's Population Health Management (PHM) program under the Health Holding Company and new regional clusters is moving into implementation. One notable project groups diabetics in a registry to ensure they receive standardized care and follow-up, an approach expected to reduce complication rates. Oman. On June 19, Oman's Ministry of Health launched updated national HIV treatment guidelines as part of a strategy to improve care consistency for chronic conditions across all governorates. The revised guidelines, developed with international expertise, standardize HIV diagnosis, ART, antiretroviral therapy regimens, and long-term follow-up protocols nationwide. They also address the psychosocial and human rights needs of people living with HIV, aiming to reduce stigma and improve retention in care. In tandem, a training workshop was held for 150 healthcare professionals from various regions to ensure smooth implementation of the guidelines. This effort supports Oman's national AIDS strategy goals of improving quality of life for patients and reducing new infections. Beyond HIV, Oman is increasingly applying population health management principles. For example, its integrated surveillance project, launched in May, which uses electronic reporting to quickly identify disease outbreaks and direct resources accordingly. Oman's commitment to PHM is also seen in its One Health approach, discussed in Section 1, tackling AMR and vector-borne diseases via coordinated multi-sector committees. These measures collectively strengthen Oman's ability to manage health at a population level, ensuring more uniform care delivery across its diverse and geographically spread communities. Palestine. The Palestinian Authority in the West Bank is working on a population health registry for non-communicable diseases with support from the World Bank. This week, health officials met to evaluate pilot results from 2 districts where all patients with diabetes and hypertension were registered and managed via family practice teams. Early outcomes show improved medication adherence and a slight reduction in ER visits for complications, validating the PHM model. The PA aims to scale this registry approach across the West Bank over the next 2 years, which could benefit an estimated 250,000 people living with chronic conditions. However, funding and movement restrictions pose challenges. In Gaza, population health management is nearly impossible under siege conditions. Still, local health NGOs try to maintain immunization campaigns and disease surveillance for the enclave's 2 million residents. For instance, despite the turmoil, Gaza achieved polio vaccination coverage of about 80% in a campaign this spring, a testament to frontline health workers. Population health efforts in Palestine remain bifurcated by geography and politics, but the commitment of health professionals to manage community health risks, from ensuring clean water to running mobile clinics in remote villages, is a steady constant. So let's now summarize and conclude this week's summary. The week's health developments across the Middle East reflect a region at a crossroads of progress and movement. On the one hand, bold initiatives, Jordan's universal cancer care, Saudi's nutrition hub and biotech surge, Egypt's pharma self-sufficiency, Oman's One Health planning indicate that many governments are fundamentally reorienting healthcare toward quality, innovation, and equitable access. These steps are gradually strengthening health systems and offer hope for tackling the region's long-standing disease burdens. Likewise, energetic wellness campaigns and public health promotions, from the GCC's midday work bans and yoga festivals to anti-smoking and anti-drug drives, show a growing societal emphasis on preventive health and well-being. Middle Eastern countries are also increasingly sharing expertise and resources with each other, as seen in joint programs, UAE WHO in Yemen, Gulf-wide healthy cities, Pan-Arab research ties, a promising trend toward regional solidarity in health. Conversely, challenges persist and, in some cases, worsened. Conflict and humanitarian crises in Palestine, Syria, and Yemen continue to decimate healthcare infrastructure and imperil millions. The Gaza Strip's health system is on life support, Syria's is fragmented and under-resourced, and Yemen's remains extremely fragile, all requiring urgent international assistance to avert further destabilization. Even relatively stable Lebanon faces an unprecedented healthcare financing collapse that could have regional spillover effects if not addressed. These highlight stark disparities. While some Middle Eastern states pursue AI medicine and genomic research, others continue to face challenges. Bridging this gap is a central regional challenge going forward. Encouragingly, the trajectory in 2025 suggests that investments in health are becoming a pillar of governance across the Middle East. Countries like Saudi Arabia, the UAE, Qatar, and Egypt are spending more on health sector development, including primary care and insurance coverage, seeing it as vital to their long-term prosperity and social contract. There is also a notable, rights-based, discourse emerging, exemplified by Jordan's framing of health as a right for all citizens and Gulf ministers advocating health protection in conflicts as a humanitarian obligation. If these principles take deeper root, they could drive further reforms such as enshrining universal health coverage in law and bolstering health emergency preparedness. The establishment of centers of excellence, whether in nutrition, Riyadh, cancer care, Amman, or research, Abu Dhabi and Doha, can also benefit the wider region through training and technical support. In summary, this week epitomized a Middle East health landscape of both impressive advancements and humanitarian needs. Major trends include a push for universal healthcare policies, integration of digital and AI innovations, emphasis on preventive health and lifestyle, and increasingly, a narrative of health as a human right and development cornerstone. Counterbalancing these are the entrenched issues of conflict, funding shortfalls, and resource inequities. The coming weeks will test whether the positive initiatives launched now, from Iraq's AMR action plan to the new aid corridors in Syria, can be sustained and expanded. There are reasons for cautious optimism. Regional cooperation in health is at an all-time high, and many Middle Eastern nations are demonstrating resilience and ingenuity in the face of challenges. If peace and stability improve even marginally in the conflict zones, the foundation laid by this week's efforts could accelerate a healthier, more equitable future for the Middle East's diverse populations. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.